All right, good morning. So we have the amazing Miss Paula Abdul with us today. How are you feeling this morning?
I'm good. I'm excited.
Great.
A little nervous, but that goes with hand in hand with any type of a procedure.
That does go with the territory, of course. Everyone's always a little bit nervous before surgery. And we'd love to hear a little bit about why we're here today and how you're feeling and what's brought us to this point.
Well, first and foremost, in case anyone knows or doesn't know, I'm a dancer.
Yeah.
Seriously, with my height, I'm petite. I started with smaller breasts, but 20 plus years ago, I had implants put in, and the more I was dancing, the harder it was getting on my back. And as the years go by, gravity happens too, and I just always felt like a little too big for my frame, and I wanted to get the old implants out. And I heard amazing, wonderful things about you, Dr. Unger. Plus, I know some of your patients, and the work is beautiful, so I'm very excited.
Well, you are a beautiful young woman, and I think we have an excellent plan for you today. So you're right, of course, time marches on, and gravity is never something we can fight for long. And so many years ago, you did have breast surgery, and as our bodies change and time goes on, of course, things continue to change. And you are a very well-known dancer. I think everyone knows that, and I think we all understand how as those changes occur, we want to make sure we're able to stay fit and stay youthful. Right. And there's certain things we can do for ourselves. There are certain smaller things we can do along the way with radiofrequency energy to help tighten and rejuvenate tissue and skin across the body. And then, at some point, it becomes the time where we need to do something more involved to help really reshape and rebuild things. So our plan today is a breast revision surgery.
Yeah.
And
I'm excited about it too.
Excited and nervous. You're going to do great. And we are going to remove your old implants. We're going to lift the breast, tighten the envelope. We do have the potential for a replacement of a small implant, right? As we talked about, we want to make sure we can reshape the breast very well and get the best overall shape and contour to match your frame. Everything I do is really very anatomically designed to help fit your frame and be appropriately petite, but also well proportioned.
Not only have I heard incredible things about you, but I do know some of your patients, and the work that you've done is incredible. And you are a pioneer in breast surgery, and the operation that we're going to do, our plan together, is one that you created and invented. So I'm excited about it. Will you tell me more?
Yeah, absolutely. Well, that's correct. So I'm really excited to take care of you, and I think we're going to be using a multimodal approach to get you the best possible result. And one aspect of what we're doing is something called breast tight, which I did help to design that protocol. And breast tight...
He's just being modest, okay? He's the man. It's him. All on him. But go ahead.
Thank you. And breast tight is using the InMode platform with a bipolar radiofrequency device to help tighten and shrink the breast skin envelope to help firm around any deeper tissue that we might have. And so in this particular case, we'll be using that around the entire breast. We'll be doing a formal mastopexy or formal breast lift because we want to get the tightest, firmest possible result, which will require an excisional procedure. We want to make sure we have every tool at our disposal. So we will be tightening your overall skin, removing some excess skin. But what I'm really excited about is the ability to use new technology like breast tight to help push that result to the next level. So instead of just taking the upper skin that of course is not quite as firm and quite as youthful as it once was when we're younger, we're able to use this technology to reshape the breast, but then tighten the skin even further and get a more elevated, more youthful result by globally treating the entire breast skin from your clavicle all the way to the bottom of the breast, which surgery, of course, standard surgery, only is interacting with the tissue along the incision lines.
Got it.
So this really allows us and allows me to push that hopefully to the next level and kind of really give you the result that you deserve.
Well, I'm very excited, and I love the radio frequency techniques and tools that they have, and I'm a big fan of it, and this is going to be great.
Yeah, it's a great platform, and I really love how it allows me to, treat some breasts independently on its own for smaller lifts and smaller elevations, and then in more involve surgeries, of course, I still use that as an adjunct to help improve shape, contour, skin quality.
Tone, the whole aspect.
That's right. So I think we have an excellent plan, and it should be a slam dunk beautiful result to help you feel at your best.
I can't wait till it's all done and I'm healed to feel how different and lighter I feel. So I'm really excited about the outcome.
Well, it should go really well.